So this is a basic gynecology office. The patient bed is over here and it has the end of the bed here, but then the stirrups are actually found underneath that part. You'll notice that they pull out and then you can adjust them to different angles and also inwards and outwards for different patients' leg lengths. There is also a light that is usually attached to the bed, and this light will swing around and you can adjust it. The on button for the light will either be at the head of the light, or in some cases it'll be at the base of the light. And then underneath the beds, sometimes the speculums will be stored there in a sterile speculum bag, and usually your provider will pick out which speculum you anticipate using for the patient. And if you look over here at the counter, you'll see lots of other supplies that will be useful to you. In particular, the fetal Doppler, you'll either bring with you into the visit or you'll find over here on the counter. There are fundal height tape measures here on the counter as well. And then there's pap test supplies and wet prep and gyn probe supplies as well. If you need any ultrasound gel for the fetal Doppler, usually that's on the counter too. So the next thing we'll go over is proper speculum handling. Most of the time, the speculums will be in a sterile bag like this. And after you choose the speculum, you'll hand it to your assistant, and then they will typically open the speculum for you and prepare it so that you can go ahead and put on your gloves and then be ready to use the speculum. So once you have gloves on, you'll hold the speculum like so. So use your dominant hand and put your index finger on the top blade, your middle finger underneath, and then your thumb will go on this little lever here. And this is really for the best stability. And typically your assistant will put some gel on the speculum. Sometimes the assistant will actually smooth out the gel for you, and sometimes you'll do that part yourself. And so if you need to smooth out the gel so that it is pretty uniform, you can just use one finger to kind of smooth out the gel like this. And then when you place the speculum, don't forget that you want to place it at a slight angle at the introitus. Next, we'll learn how to make a wet prep. When you collect your specimen with your Q-tip, oftentimes your MAs will put it in one of these plastic tubes for you. And then when you come to the microscope station, you will need a couple drops of normal saline, and you'll just go ahead and put those in your tube. Usually I'll take the Q-tip and kind of mix it up just a little bit. When you make your wet prep, you will first grab one of the glass slides and just put a small amount of the sample on the middle of the glass slide. And there's also cover slips at the microscope station. So you want to take a cover slip, put it on your sample, and then you can put it on the microscope, and of course start on low power. You'll view your specimen here, and don't forget about Amsel's criteria for diagnosing BV. Other things you'll look for on microscopy are trichomonas and yeast. The other things that are important to test are the pH of the specimen. So you can just take your Q-tip and a little bit of pH paper, and then you can compare the color of the paper to the pH testing strips. And then you also will want to do a whiff test. And usually I'll use the same glass slide and I'll just use the opposite edge. So you'll put a small amount of fluid on the edge of the slide. There are small KOH packets here that you'll just squeeze tightly, and then put a couple of drops of KOH on your sample, and then you can do the whiff test. So this is a fetal Doppler that is used to check the fetal heart rate. Usually you can use this pretty successfully after about 10 weeks in thin patients, maybe a little bit further along in more obese patients. When you use this, it's very simple. You will just take a little bit of ultrasound gel. Make sure you aren't using the sterile gel for this. And just put a little bit of the gel on the end of the fetal Doppler. And then you can turn on the device. The buttons might be in different locations depending on your Doppler. And then the volume is adjusted on the side. And then you will take this and place it on the patient's belly, and then you'll be able to detect the reading here. And you want to make sure that you can usually hear the numbers as well as see them and make sure that they're matching up. The next thing is the fundal height tape measure, and you'll use this on pregnant women who are beyond 20 weeks gestation. You might find that not all providers use this, so just clarify with your preceptor on whether or not you should take a fundal height when you are seeing an OB patient after 20 weeks. These are found on the counter, and the first thing you'll do is unfold this and notice that the 0 centimeter mark is actually a couple centimeters in from the end. I always like to just fold that, so then I'll know that that fold goes on the pubic symphysis, and then we will measure from the pubic symphysis to the top of the fundus, and then that will be your overall fundal height. Our offices are equipped with bedside or portable ultrasounds, and these are used mostly for obstetric scans, although sometimes we'll use them for a quick GYN scan. There are 2 different probes that we'll use. The first one, which is probably the one used most common, is the abdominal probe. And before we use this, we'll always take some ultrasound gel and put it on the actual probe. The second probe is the transvaginal probe. And when we use this, we'll use a cover. And similarly, we'll put some ultrasound gel in here. Don't worry about learning all of the buttons on the machines. They're all a little bit different, and your preceptors will help you with that. This is a transvaginal ultrasound of an early pregnancy. You can see the fetal pole here. This is the head and this is the torso. And you can also see a small circle to the right, which is the yolk sac. We can measure the fetal pole by placing markers from one end of the fetal pole to the other, from the crown to the rump. This is called a crown rump length. And then you can see the size of the gestation in the lower right hand corner.